I really would like people to understand that living with HIV has nothing to do with being different or difficult or any negative. It's just something that happens. If we swapped jobs for a week, what do you think would be the most challenging part for me?
Oh, wow.
And then I'll tell you.
I'm struggling really to
I think patience. I'm not a very patient person. Oh, yeah.
Well, that's never come across.
I think you're very patient.
Okay.
I think I would struggle with that. I think for you, your biggest challenge would be to pronounce all the drug names with my accent.
Definitely.
Yeah.
Why do you do what you do?
I've been wanting to be a doctor since I was a young child. There was a manga cartoon called Candy Candy that I used to watch when I was 5, 6. She actually wanted to be a nurse, but yeah, I just decided that's what I wanted to do. No one believed I would ever become a doctor. I was quite wild as a teenager. My interest for HIV was, I think, developed very much when I volunteered during the summer in rehab communities in Italy. Young people who used drugs in the past had HIV and knew they were going to die of AIDS.
Yes.
In the early 90s.
Wow, okay.
And that was very, very, very touching. Describe a moment that forged your commitment to your work.
Well, that would be my own diagnosis with HIV. So that was back in 2008. And I was very lucky at the time because a lot of my friends were living with HIV. So I knew that it wasn't something that I was going to die of. I felt accepted. You know, I didn't have a lot of worries around the diagnosis itself, I guess. I'm also a bit of a geek, so I wanted to learn as much as I could about HIV and its treatment as it happens. And so I spent a lot of time, researching and, reading stuff. And then I thought, I've got all this information, what do I do about it? Do I just sort of, keep it for myself, or can I use that information to, help other people, really? And I guess that's how I got into supporting other people living with HIV. I really do feel it's a real privilege to be there for somebody else, because a lot of the time people are at their most vulnerable. They share such difficult stories or share their situation. I would never have come across so many people that I've supported and people that I've worked for if I'd not had that diagnosis. So I suppose I'm always somebody that thinks, regardless of what happens, I can always see the good part in it, I think. That's what I try to do anyway.
What you said is very rare. You said I was diagnosed with HIV and I felt accepted. And we are fighting so much the societal poor acceptance still of HIV nowadays.
Yes,
right?
and I think, when I say I was quite lucky, I feel that has really helped me. That I did feel that acceptance, that I didn't feel this huge burden of stigma, I suppose.
Neither internalized, is that right? Because that's rare, isn't it?
What I've tried to do around that is sort of provide people with some kind of hope that you can change things, you can feel less internal stigma. I think that's so important because, you know, that's our biggest struggle, isn't it?
Absolutely. Nowadays is the biggest struggle, and listening to you is really fascinating, and it helps me because I think you can see both. You can see how to live with HIV without the internal stigma, but you do understand it. And for me, it's difficult sometimes because I would like to be successful in transmitting, in making sure the person in front of me who is living with HIV and experiencing internalized stigma can get over it and be successful in resolving it with themselves and have a good life.
Absolutely.
But it's very challenging, and I think sometimes hearing from a doctor, it might not be the right rapport. That's not what they would expect. People might just expect other things. I don't know, but it's very interesting to hear that there is a way.
What has been your most challenging moment at work? I'm sure there's been many.
Oh, I'm sure there's been very many. I can't think about a moment.
Maybe those early times were quite challenging for you.
So the early times were beyond the challenging. Before 1996, when the antiretroviral became available, I was a very junior doctor on the wards, infectious disease wards in Turin in Italy. I remember taking the bus home every day from work and crying, every day. And I was 26.
Wow.
What it was challenging at the time was the frustration that there was nothing we could do. And then I went to San Francisco a few years later in 1998 when the drugs were being prescribed regularly. And it was incredible because people started to live again. We know we have so many tools to make them feel better if that's what they want. What has been the most informative experience that has shaped your understanding of your work?
Wow. I think actually the work that we've done with the peer support service, I don't think I was really expecting to find that there is a significant number of people who their life is just absolutely turned upside down by their diagnosis, and it's been a real eye-opener for me. I knew that a lot of people struggled with taking their medication, but I didn't know to the extent and what were the issues around that. And actually within the HIV community itself, there is a little bit of lack of understanding of why somebody can't take their treatment. And I think sometimes that there is that thing that, you can't be a good person if you don't take your treatment, because you're then, not only are you injuring yourself or causing harm to yourself, but you could potentially causing harm to others. Just having a real understanding of it and working through some of the difficulties that people have. I really hadn't appreciated some of the challenges that people face. What's the hardest advice you've had to give and why?
I think the hardest advice is to convince people who don't want to take their treatment to take their treatment. It is difficult to give advice because I try to listen to the person and I try to, mold the advice on what they say. And I try to mold and I try to mold. And at one point it becomes unmoldable.
Yeah.
I just say, when I was 25, I used to see people dying every day, and that's not going to happen to you, is it? I don't like it.
Sure.
I really don't like it, and I find it really hard.
Absolutely. And, I know that you work really hard when you're moulding those things, some of your treatment choices, are really because of what that person feels they can tolerate. They'll be part of you. I'm sure things that's not an optimum treatment, but if it gets them to undetectable, then that's great. That's all I need to worry about, kind of thing.
What do you feel may be a doctor's biggest blind spot and why?
Oh, wow.
Oh, come on, challenge me.
Oh, wow. Perhaps doctors, you were perhaps a little bit too cautious. As somebody myself, I've always been, involved in my treatment and care. So when I started treatment, I was given two options. I said what I didn't want. I was given two options, and that gave me ownership of it then. And so perhaps sometimes, there has been a little bit too much caution maybe. If we can explain to the person exactly what the situation is, and let them make that decision with guidance from doctors, obviously, and just support them as much as we can through
absolutely.
that. What do you wish people understood more about HIV and why?
Oh, yes. No, this is really one of my things. Where we mentioned it earlier, I really would like people to understand that living with HIV has nothing to do with being different or difficult or any negative. It's just something that happens. Again, we talked about the older days. It was completely different at the time. Nowadays, it is what it is. And if we can just change that last piece of the puzzle and completely erase the societal stigma, I think we would contribute remarkably in resolving the internalized stigma. I think that's a little bit more complex, and I wouldn't say that I'm the person with the power of doing that. But the societal one is absolutely ridiculous.
It's a tiny virus, and yet it can have a massive effect on somebody. It would set free so many people from having to live, double life or a life that is very restrained or constrained because of HIV, and it's such a shame when you see that. Absolutely, yeah.
If we never meet again, what's one thing you never want me to forget?
Oh gosh, just be you. Just don't forget your contribution that you've made to so many people's lives living with HIV, those that you directly care for, but also those that have benefited from some of the research that you do, and your commitment to those, and your commitment to the specialty, I suppose. So, yeah.